Hey everyone, welcome back to the A to Z Sibo series. I'm Kendra Perry, I'm your host, and I am a functional diagnostic nutritionist and also an expert in Sibo. So if you missed video 1, make sure to go back and watch that. In that video, I talked about the different types of Sibo, how to test for Sibo, and where you should actually start when it comes to treating your patients or clients who have Sibo. So in this video, I'm actually going to go through the Sibo treatment that you should employ with your clients or on yourself if you have Sibo. Okay, so let's start with diet. So this is a question I commonly get. So a lot of people know of the Fodmaps diet. So Fodmaps is basically highly fermentable carbohydrates, which are actually very healthy for all of us. But if you have Sibo, they can actually lead to a flare-up of the symptoms because they actually will feed the bacteria. So the biggest mistake that I see people make is that they are doing a Fodmaps diet thinking that it's going to get rid of Sibo. It will not. Absolutely not. It's going to starve the bacteria and make them go dormant and maybe reduce the symptoms, but it's actually not going to kill off or get rid of the Sibo. On top of that, you would actually never want to employ a Fodmaps diet in your patients who have Sibo, because the Fodmaps, like I said, will actually make the bacteria go dormant, and your protocols, so your herbal or antibiotic treatment, actually won't work on dormant bacteria. So we want those bacteria to be active, so it is actually important to eat some Fodmaps food while going through a Sibo protocol. Now, if your patient or client is really reacting to those high Fodmaps foods, they're probably going to want to reduce them, but they still want to add in a few. But if the foods aren't actually bothering that person, then it's okay for them to consume Fodmaps during a Sibo protocol. So what type of diet is best? I usually go with a paleo diet. I think that's a good diet for gut healing, and that's usually where I start. But you may want to do AIP if you have clients with autoimmune or more severe gut issues. So number one thing to remember is we don't do Fodmaps during the Sibo protocol. We do it once we've gotten rid of the Sibo, which I'm going to talk about in video 3. Okay. So basically when it comes to Sibo treatment, there are 3 different types of protocol routes that you can go. So number 1 is the antibiotic route. Number 2 is the herbal route. And number 3 is the elemental diet. So typically when I work with clients, I like to go the natural route. So I always start with the herbals. But it's not a wrong thing to go for antibiotics. What is the best form of treatment? Well, it's the thing that works for that person or that patient or that client or you. So it's all individualized, so it depends on the person, and not everyone's going to respond the same to each type of treatment. So I like the herbal protocol because I think it's a good place to start. I don't usually like starting with antibiotics. That's typically what I'll use when the herbs don't work. But there's actually been several combinations of herbs that have been clinically studied to work just as well as the antibiotics. They're just going to take a little bit longer than the antibiotics. So typically I'm going to use Metagenics, Canabactin AR and BR, those 2 together, or I'm going to use Biotics Research, Dysbiocide, and FC Sidel. So those have actually been studied in clinical trials to be as effective as the antibiotics. So you're going to want to do that depending on the gas levels of the person. Lower levels of gas levels might just need 30 days, whereas when they're higher, you're going to want to go maybe 60 or 90 days depending on the person. So typically I'm going to do about 60 days. That's probably the most average, but sometimes I'll do less or more depending on the person. Okay, so that's the ones I just mentioned that have been clinically tested. Those are for hydrogen only. You would not actually employ these if you had methane dominant Sibo. If you have methane dominant Sibo, what you're going to use is Alamax Pro. So you guys maybe are familiar with Alamax. So basically it's just concentrated garlic extract, but you don't want the regular Alamax because it's not potent enough. You want the Alamax Pro. So it's going to be a little bit more expensive, but it is potent enough to get rid of the methane dominant Sibo. If Alamax Pro doesn't work, you can also try a product called Antrantil, which was formulated to deal with methane Sibo. I see kind of really opposite effects with it. In some people it does nothing, and some people it really helps. The other thing you could try is Jarrow Formula's Ideal Bowel Support. So it's actually a strain of probiotic that crowds out the methane dominant bacteria. So that's what you do with methane. So that's why we want to know what type of Sibo you actually have, is because it's going to affect the protocol. Okay, so the second thing I'll talk about is the antibiotics. So I will go this route if the herbals don't work. I'll give the herbs a really good run for their money. If they don't work, I'm going to do antibiotics. So it depends, again, on the type of SIBO, but if you had hydrogen-dominant SIBO, you go with rifaximin. The thing I like about rifaximin is it stays in the GI tract and it doesn't go systemic, so it's a relatively safe type of antibiotic. The one thing, though, is that it's very expensive, and it can run you upwards of about $1,000 for a 2-week course of treatment, so it's very expensive. The one that you'd want to use for the methane-dominant SIBO is metronidazole, which would deal with the methane, but it does go systemic, so it's not super safe. So I don't really like to use the antibiotics unless the herbal route has failed. But for some people, this is going to be the only way to get rid of it. So like I said, it's not wrong to go the antibiotic route. You just have to do what's right for you or your patient. Okay. The third one, and probably the one I recommend the least, is the elemental diet. So basically the elemental diet is a shake that you consume for 2 weeks. It basically just gives you all the minerals and nutrients you need to function. And then other than that, you're fasting. So you're not eating anything except for this shake. Can be very good with stubborn cases of methane, but it's very intense and not everyone can go 2 weeks without chewing food. And in some people, it may even cause long-term side effects. So I only recommend it when nothing else is working. There's a few different options. There's Vivanex Plus by Nestle, which I hate because Nestle is an evil company, in my opinion. And they actually probably produce products that give people SIBO, and then they charge people an arm and a leg for their elemental diet formula. Luckily, Integrative Therapeutics has made a elemental diet, which is very good, or you can do a homemade formula by Dr. Allison Seebecker, which you can actually get on her website. Okay, so what about other types of supplements? What else should we be doing? So should we be doing a biofilm disruptor? So the jury is actually still out on this. Clinical trials have shown that it doesn't improve treatment, but I know Dr. Michael Ruscio has shown that a biofilm disruptor leads to lower levels of hydrogen gas in the long term. So maybe, maybe not. I don't typically use them, but you might want to do some of your own research and determine if that is a good course of treatment. Pretty much, other than that, I don't do a lot of other supplements for SIBO. I pretty much just do the herbs. I do the paleo diet, and we retest. So you want to absolutely retest to confirm eradication after you've done a SIBO protocol. Otherwise, you have no idea if you've actually gotten rid of it. So they're going to stop the treatment. You're going to want to give it 2 weeks time that they're off the antimicrobials or the antibiotics so it doesn't affect the next test. And then they should be rerunning the SIBO test. And if your gas levels are still high, but they're down since the first test, then you want to continue what you're doing because it's working. It probably just needs a little bit longer to work. If gas levels have not changed or they've actually gotten higher, it's time to change your course of treatment. So if you tried an antibiotic and that didn't work, you might want to move on to the herbal formula. If you've done herbal, maybe you're going to try an antibiotic. And if you've done both of those and nothing is still working, this might be a time to move into the elemental diet protocol. So you basically want to repeat this, and sometimes you have to do it multiple times before you actually get rid of it. But you want to basically confirm that you've actually gotten rid of the SIBO before moving on to other protocols. So repeat until your client gets those results. Okay, so this is all for video 2. In video 3, I'm going to go through what to do once you've gotten rid of the SIBO to prevent it from coming back in the future. So that's coming up in video 3. So I'll see you guys then.